Hey guys, I'm just here with my good friend and colleague Melissa today, and we decided that we wanted to hop on here to offer you some tips and tricks for enhancing brain function. So I am going to let Melissa introduce herself and let you know what she's all about.
All right. Thank you so much for having me. I think this is going to be a great chat. I'm Melissa Biscardi. I'm a registered nurse and manual osteopath. I work in Toronto, and primarily I work with people who've suffered a brain injury or people who are looking to optimize their brain health using non-pharmaceutical strategies.
Amazing, love it. And I'm a naturopathic doctor. My name is Christina Carreau, and I work in Toronto primarily with a population that is too busy. So people dealing with high stress loads and then all of the side effects that kind of come with being really busy. So again, cognitive function being one of those side effects of having really high stress loads. So anyway, I think that we'll have a lot of alignment sort of in terms of who we see. But yeah, I'm just going to start, Melissa, by asking you to debunk a few myths for us about brain health.
Sure.
So number one on my list is that memory loss is normal.
Yeah, so this is a big one. And I always like to say, if something might be common, that doesn't mean it's normal. So often we normalize losing our keys, forgetting people's names, but that's fine and dandy until we forget what our keys are for. So I always say, memory loss is not normal. We want to be as sharp as that sharp 93-year-old, right? Set your standards higher. And if you start noticing some memory things, it's probably time to take a look at your lifestyle and maybe some factors that might be contributing to it.
Okay, good. Glad to know that. I'm going to be the sharp 93-year-old
Right?
like
Yes.
grandma. Yes. And another myth that I came across was that that we can't learn new things as we get older. What do you say to that?
Yeah, just that also needs to be debunked. And it is a little bit harder to learn as we age, but I also think you have more things on your mind. But we can absolutely learn neuroplasticity, which is, creating new neural connections happens as we age. So actually a great thing to do while you're aging to support brain health is learn a new skill, take up a new hobby.
Awesome. Yeah. Well, and I think just one thing on that I think is really interesting is that I think even our willingness to try new things sometimes diminishes, right? Like when we
Yes.
start thinking about, like with kids, they are always talking about, I did something new and I learned a new this and I learned a new that. And then as we get older, we sort of move out of that role of student sometimes, right? Where we're kind of dabbling and trying new things. It's almost like a mindset piece
Yeah,
around learning new things.
absolutely.
So
Almost a fear, like a fear of, I don't know if it's a failure or maybe, yeah, like, oh, I won't be able to learn how to knit, which I do
yeah,
tell myself.
ship has sailed.
Yes.
Yes. Um, okay, excellent. And then the third myth that I was going to ask you about was, that cognitive decline, that we can't do anything about it, right? That it's irreversible. So just that, yeah, as our cognitive function declines, what do you say when people say that it's, a write-off, like you can't change that if it's in the works?
Yeah, I definitely think we all have to hold our cognitive health to like a higher standard. And also, if we do start to notice some little changes, that's when you want to get in, but also that you can get in. So that whole neuroplasticity thing, and we can regain health, just like you can rehab an ankle. It just might take a little bit more effort when we're talking about the brain, but never accept cognitive decline. Like you should fight for your brain.
Awesome. Love that. Great reminder. Yes. That should be your
Yeah,
hashtag,
my motto.
right?
I like it. That's the first time I said it, but I like it.
You should fight for your brain. Okay, awesome. So now on to how can we fight for our brain health? Let's talk through some of the things that we can do. So
Absolutely.
we kind of chatted a little bit before our session today, just in terms of different areas that we were going to target. So we're going to kind of talk you through supplementation that you can use to enhance brain function, as well as dietary recommendations that you can use. And then we'll end on lifestyle things that we can do. So I'll start out with talking a little bit about fish oil and omega-3s specifically. So as they pertain to brain health. So we know that fish oils contain EPA and DHA. I don't want to get too bored, I don't want to bore anyone with all the details of the constituents of fish oil. But again, we know that fish oil is very anti-inflammatory, and the brain is also made up of a lot of fat. And generally our diets tend to be quite devoid of omega-3s. And so one of the ways that we can enhance brain and cognitive function is by supplementing with fish oil and with omega-3, with fish oil over just straight up omega-3s, right? Because we do know that there are other non-fish sources of omega-3s, like flaxseed oil, for example, which are not necessarily inherently anti-inflammatory. We have to convert them into those anti-inflammatory constituents, and humans are not always great at doing that. So again, fish oil can be helpful because it helps with the communication between cells in the brain, but also because of this anti-inflammatory nature that it has. And again, we know that our lifestyles tend to be inflammatory, but also we have science that talks about the ways that it can enhance learning and memory, as well as mood, right? So fish oil is kind of just an all-around powerhouse in terms of enhancing brain function. And again, just a little disclaimer, because fish oil is a blood thinner, you do have to be careful about self-prescribing fish oil. You should always talk to your medical healthcare provider before starting on things, but I do want to put in a plug because I think that it is such a powerful one and helps us on so many different levels.
Absolutely. And I think I'm glad you noted that disclaimer, because I know sometimes we hit the ground running and we think more is better, but actually that's not necessarily the case, right? Yes. And yeah. I know if you take too many fish oils, definitely blood thinner, and also I'm pretty sure it can really upset your stomach. So it's the right dose is important for sure.
Yes, absolutely. Yeah.
For supplements, I'm definitely a fan of fish oils, of course, and for their anti-inflammatory properties, especially these days where most people are stressed. Yeah. Even if things are going well, you are stressed because it's a pandemic, yeah. Right? But there's a supplement I really love, and it's not well known, and it's GPC, which stands for glycophosphocholene. And there's research for it in healthy brain aging and also in brain injury. And it supports a chemical in the brain, acetylcholine, which is the memory chemical. So that is great as we age, supporting memory, supporting learning. And it's one of the few I take it myself. It's one of the few supplements that I have taken and literally noticed a difference in my mental clarity. And I think that speaks to the supplement, because if a relatively healthy person notices a change, then it really shows how powerful it is.
Absolutely. Okay.
So that's my go-to.
I've got to Google this one.
Yes.
I know it's been in formulas that I've used for enhanced memory, and I think it's even in brain memory, like a product that I've used, but I haven't seen it as a standalone. So I'm going to look for it.
Yeah, it's available as a standalone, as a dropper for under the tongue. Okay. When I used to work in a clinic, we would do it IV, which of course is always great, but I haven't seen that in a while.
Okay. Excellent. All right. And then in terms of diet and brain health, do you have any specific diet recommendations that you're generally implementing or recommending for clients to enhance cognitive function?
Yes, I definitely suggest like an anti-inflammatory diet. So unless you're living in Italy, avoiding like the glutens, right? The pastas and the breads. Or if you're going to have bread, have one made with almond flour or something like that. I do usually recommend limiting the dairy, which I know some of my patients hate me for, but inflammation is not great for us, and it just contributes to that sort of decline in our tissues. So that's sort of like the overarching theme of my diet recommendations usually. Okay. What about you?
Yeah, there's probably a few people that are like, okay, I got to leave this call right now.
Exactly. Right.
About gluten and dairy.
I know.
But no, I hear you loud and clear in terms of the inflammation and brain health. I think that, again, a lot of the research that I was looking into before we had this conversation, and again, just a lot of, what I'm talking to clients about in practice is about blood sugar regulation,
Yes.
right? And the impact that has on brain health and cognitive function. And again, we can talk about research in textbooks, but a lot of us have experienced that hands-on, right? When we're fueled
Absolutely.
well, versus when we fueled too much on carbohydrate and didn't have enough fat or didn't have enough protein, and how we can literally feel like we need a nap afterwards, right? So again, the brain can acutely respond to glycemic index, like a high glycemic index load. And so then when we think about this logically, if we're doing that on a semi-regular basis, what's the long-term effect of that, right? If like the short-term effect is like, I need to have a nap, what's the long-term effect? And so again, I think that that's probably one of the main things that I talk to clients about with regards to blood sugar regulation, again, because we're talking about stress, and we know that stress does dysregulate blood sugar so already. And so then again, the extra importance of being a little bit more mindful of the glycemic load of the foods that we're putting in. So, but again, I could say that they're very similar, what you and I are talking about, right? Because
Absolutely.
diabetes is an inflammatory condition, right?
Yeah, and another thing to know is sometimes you might not be diabetic, but you still don't have great blood sugar regulation. And then it can interfere with sleep, and sleep interferes with brain health. Like, it's such a snowball effect, right?
Exactly. Right. And we don't go from having perfectly regulated blood
Right.
sugar to diabetes. It is
Exactly.
a journey, right? And so then again, we know that we can be, slowly impacted, or just having, again, feeling the effects well before a diagnosis is made, right? And then the last thing I'll say about diabetes or about blood sugar dysregulation, again, we know that it is damaging to smaller vessels, right? So we know that the
Absolutely.
brain and the vessels of the eyes and the kidneys are going to be areas that are targeted first. So again, we're speaking specifically about brain here, but that's another sort of reason to be mindful in terms of blood sugar regulation.
Absolutely.
Yes. Um, and then lastly, we were going to chat about lifestyle stuff, right? For
Yes.
brain health.
So my big thing is movement, right? Movement is life. We need to move for our health, for our nervous system, and actually, how fast you walk is a indicator of your brain health. Right? So it's funny that, so let's say you're walking fast and you notice some older people just shuffling along and you pass by them. Oh my gosh, they're walking so slow. But then one day you're walking and some people rush by you and say, oh my gosh. So then you know where you are on the food chain. Right? So I say definitely integrate some movement every day if you can, even if it's just walking at a conversation pace, right? And nowadays, a lot of people are working from home. They're not even getting the walk to work. So we have to be a little bit more purposeful. But movement is really, it's a game changer, right? We really need it for a healthy brain, healthy body, healthy heart. So that's my lifestyle tip.
Awesome. Love it. Yeah, I'm a huge believer in that as well, not just for the physical body, as you said, but for all of the mental benefits as well, right? Like we know that it releases happy neurotransmitters and endorphins and all of that stuff that can be fairly addictive, actually.
Yes, I was just thinking that.
Yeah. So, and then, in terms of lifestyle piece that I was going to touch on, it's stress management, right? So we know, again, when it comes to brain health, when we're in kind of, a heightened state of busyness or overwhelm, or when we've activated, that fight or flight part of our nervous system, we know that we're using two very specific parts of our brain. And we know that we're not activating a huge part of our brain, right? Our thinking brain is not being activated. And so again, we can kind of get stuck in that cycle, that vicious cycle of stress for longer than we are, quote unquote supposed to, because we're not engaging that part of our brain. And then the detrimental effects of that over time are quite vast, right? We can see changes in mood, right? It does, long-term stress definitely impacts serotonin levels. So that can increase anxiety or increase likelihood of depression. We know that stress as well is going to play around with our circadian rhythm. We've also, research shows that chronic stress will cause changes in the blood-brain barrier, right? And so again, when we think about that barrier is keeping us safe from all kinds of toxins, and so stress can be depleting that barrier. So again, there's just the importance of being mindful of where we're at in terms of our stress load and our busyness and our buzz, because it does have impacts on our ability to think. That has impacts on our ability to retain information, and also just to feel good, right? So
yeah, I really love that you touched on this, because that if we don't manage our stress, it literally will shrink our brains, right? That inflammation. So I know it's easier said than done, do some stress management, but we need to, right? It's just, it's a game changer. So I
yeah.
think a lot of people have been reflecting over this time and maybe making some lifestyle changes. So I'm hoping we keep with them. That's for sure.
Yes, absolutely. I know. So yeah, I think anyway, I think this is a really awesome conversation, and I'm super excited that I had the opportunity to sit down and chat with you about this. And I'm
Likewise.
sure that I'll wanna pick your brain on some of this again. So again, thanks
We'll
so
have a
much,
longer chat.
yeah, exactly. When we're not so busy.
Yes.
Yeah.
Right.
Anyways, it was so
Amazing.
great chatting with you. So have an awesome rest of your day, and I'll talk to you soon.
Likewise. Bye.
Okay, bye.